Hey everybody, today I thought I would do something just a smidge different. I'm going to launch a poll real quick, and I'm just curious to see what are the content areas, because then I know actually if there's a ton of people who want to look at neuro, I can actually focus a little more on neuro. So I'm just curious, as you click in on the poll, what are the kind of areas that you are teaching in? And it'll allow me to actually spend our time most wisely. Good to see you, Jeff. It's been a long time, brother.
Good to see you.
Yeah, good to see you. So yeah, it looks like there's some integumentary, anatomy. Okay, great. Neurologic is big. Yep. Yeah, actually, we're filming some really, really cool stuff for both peds and neuro. I'll make sure I tell you guys a little bit about that. So we've got fundamental skills. Okay, great. We'll just take one more minute and then we'll go ahead and get started. So James, it looks like neuro, fundamental skills, there's a little bit of musculoskeletal, and then acute care also. So I'll hit the four main big areas. Part of me putting in geriatrics, integumentary medical screening. There's some laws and regs too, James, that will be interesting for you to ask a little bit about.
Can I see the results of that, or is that something just for you?
Oh yeah, let me
so I can just document it and we have it for future reference.
I will, in fact, let me see what I can do here to make it a little bit bigger. I'm pretty sure I can share it, but this is my first time running this, so
okay. Yeah, see, I just have the questions still. I don't have the results.
Okay, yeah, let me end the poll and just share the results.
And about to get offline later, that's okay too.
Yeah. Yeah, so let me share the results to everybody. Can you see that?
Yep.
So that's quite useful.
Wow.
Great. There's some laws and regs. I mean, James was at some point my professor, is now a colleague, and he is building some really amazing laws and regs modules for every state. It was a crazy endeavor, but we just couldn't think of a better way to help students learn about laws and regs than to create scenario-based situations where laws and regs would apply. And so we're finished California, James. I think we finished Texas.
California, Texas, New Hampshire's real close to being done. Alabama is now, Arizona's next. Yeah, there's quite a few that are getting really close to on the cusp of getting then transferred to the app.
Yeah. Yeah. So, this year, 2021, is really a year that I'm thinking of solving interesting problems beyond the kind of apps that we already have. I'll show you glimpses of that. We're filming tons of evaluations of real patients, neuro, pediatrics, orthopedic. We're going to film some simulated acute care situations, because in the back of my mind, I always remember the students asking, would you show us, give us a picture of how this thing is done? Could you do evals for me so I could watch and learn and hear about your clinical reasoning? Well, yes, except I never had time and I never had real patients. So now we're bringing in all these real patients and we'll film the full evals. And then we're breaking them into little pieces so students can watch little pieces of it and experience the process, look into our minds to develop their clinical reasoning. I think there's no better way to set the context for a 2-semester-long orthopedic course or a 2-semester-long neuro rehab / neuro eval, right? Our course is broken to exam and interventions. Then to be able to see it from the beginning. This is how it's done. These are all the pieces of reasoning that are going on in my mind as I'm watching this patient. And then they get to fill in all the little details throughout the 2 semesters. So some of that stuff that's going to come out is we're very, very excited about it. It's basically trying to fill a bunch of holes that I know that our current apps don't fill well, which is the development of clinical reasoning, the case studies and gamification of learning. We've been building it since last year. Actually, it just takes a lot of time and a lot of effort to build it. But anyways, let me go ahead and get started. I'm going to share screen and okay, I think recording is already going on. Great. Hey, welcome everybody. It's been a long time. I feel like I've been in the trenches since fall, and honestly, some of it's been okay and some of it's been not that pretty. I mean, we're this week, last week we did a bunch of mock evaluations. I'm at the last 6 or 7 weeks of ortho, and we're noticing that, man, they're having a hard time with some of their manual skills because the amount of time they have to practice it is limited. And the second part, which is generally always been an issue, but is still an issue, is, man, I'm still not sure when to use these skills. And so there's the clinical reasoning components that I think really could be solved by mini games that we're building. So these mini games would allow students to apply all the things we're teaching them, like in shoulder week. They can play 3 mini games: a frozen shoulder game, a shoulder instability game, and a shoulder impingement game. I think they need to play these because it's a stepping stone for them to sort out all of this data that we're pushing into their brains. And then they can really, when they come to the point where they're doing these mock evaluations, it's not the first time that they're fumbling with all of these tools. We've actually kind of narrowed down the pattern. They see how it needs to be applied. So yeah, there's a lot of great things that we've been building. We're actually on the tail end of refining. There's a lot of accessibility issues that we're learning about, and we're trying to make sure we address. But for today, I'm grateful to have you join us, for me to be able to show you around a little bit about our apps, about how I can share little tips about how we're using them in the classroom. And I'm eager to hear things that you need and things that you might want to contribute to creating as well. So my name's Michael Wong. I think, yes, we're recording this session for the faculty who can't attend. And I've been at this for a long time now. This is my 18th year at Azusa Pacific University. My class size has grown from 12 to 72. And I'm proud to say we generally do a pretty good job of trying to get these kids to become clinicians. And I really think a couple pieces of that has been the effort we make using the apps to really draw big picture context. Because there's so much stuff that goes on in ortho, between ortho and TheraX and movement science, all of these pieces that we're delivering week by week, that if they don't have a big picture, they're just confused at the end. It's a big pile, it's a mess. So at the university, I serve as a teaching and learning fellow. I did my training at Kaiser for orthopedic residency and a manual therapy fellowship, for which I teach for now. I also teach and use our apps at the USC Spine Fellowship. So we use it as a guideline implementation tool. And then we've been building apps well before the pandemic. I think all of us agreed that for a motor skill heavy profession like ours, to have videos and organized videos really is very useful for students to develop motor skills. And so we've been building apps for a long time now, since 2013. And on top of all that, I get the pleasure of chairing our IRB. And yeah, those are some of the roles that I play at my university. So this is us still trying to have a good time. This is Halloween. I was a bottle of Sriracha. Marshall, as you can see, was Dumbledore. And all of our kids are broken up into 5 different rooms. So we had about 16 to 18 kids in 5 different rooms. And we are running our labs using a lot of the PhysioU videos, because lots of times the view from those videos are actually better than someone trying to hold a cell phone or using our camera system. So some of the times we used PhysioU videos, and some of the times we slowed things down and we demonstrated certain techniques. And so there we are, trying to have fun. And this is one of the key things, actually, that I think students really need. And that is a chance to be the PT and to make the decisions from the subjective exam to the objective exam to treatment, reassessment, and education. This entire process we do about twice a semester. Every single one of these students will be the therapist for a patient these are fake patients, for the most common clinical patterns. And they will each watch and learn from one another the process of thinking and the process of doing evaluations and treatments. This is almost more valuable than a lot of our lab time. The lab time, they can learn many of the techniques using the videos, but really giving them a safe place. This is non-graded. They just know it's going to happen twice a semester. They need to have their skills ready because we're going to count on them to make some decisions. And none of those decisions are going to be deal breakers, meaning there's no risk of failure here. It's all about collective learning. And so we and the students very much enjoy this process. We're about to do this again in about a week, where we're covering all of the upper quarter, cervical, thoracic, shoulder, and then we still have elbow, wrist, and hand to teach. So moving on. So a little glimpse about why PhysioU and what is it? Well, when I was young, still young, maybe 5-6 years into my teaching career, I had written a small reference guide textbook. This was about clinical patterns. I was trying to connect a bunch of dots that I couldn't connect in my classroom. And I said, these things that the students are carrying around, these phones and iPads, maybe there's something we should build to organize information in a non-sequential way. Meaning books are always chapter by chapter. It's hard to reference chapter 7 for cervical spine when you're talking about chapter 2, shoulder, and to make those two connect properly. So we thought, why don't we start trying to build apps? So that's one of the reasons we did it, was really to think about a new way to deliver information that's non-sequential. But we always note, and I think all of us can recognize, the high cost of graduate education and the low income that the students are bringing as clinicians. I just saw a post on Facebook. This was on the Doctor of Student Physical Therapy forum that says, do not take a job for less than $65,000 a year. I'm like, wow, how is a student ever going to pay their debt off? If that's the level of income for our doctorally trained students. So I am very, very cognizant of the cost of textbooks, of the cost of all the different types of reference materials that we ask the students to use. This is a conversation that's been going on in our department, and it's partly why we started building a bunch of apps. So the other thing was that it was tough for me and it was tough for the students. The textbooks that always go out of date, the need to keep buying newer textbooks. Why couldn't we create a resource that was always up to date? We just remove stuff when it's no longer relevant. We add new stuff. The apps are constantly evolving. So that's another reason why we built it. This is my own little pocket orthopedic guide. It's already 10 years old. They still have stock, which means I don't get to write an update. Well, we're doing updates in the apps almost every couple of weeks as different faculty speak in, new research comes in, we set a date to film new techniques. So we're always updating the apps. We also realize that a lot of our resources are not that mobile. So between the binders of our notes, well, now many of them are PDFs, but also our textbooks, that the students don't carry them with them when they go out into the clinic. With these apps, it's always there for them. The students have mentioned really the apps really come into a lot more value. They've left the classroom, they're now out in the wild, and thank goodness, all the therapeutic exercises, all the special tests, all the manual therapy techniques are at the push of a button in my pocket. So it comes into its own again when they go out into the clinic. Most of the techniques and videos in our apps are scattered across YouTubedom. You can probably find it, but whether it's done right and whether it can be in an organized fashion for you to deliver is a different question. And so what we've tried to do is really think of this from the academic side and think of how easy we could organize this content to make it easy for you to teach from and for the students to access. So high quality resources to assist in motor learning. And then a lack of resources to create context. So I recently got an email from a faculty member who said, hey, I'm really interested in your clinical pattern recognition orthopedics apps. It seems really extensive. That was my baby. That was the first set of apps we built. It took us a year to build one app for low back pain because we were trying to connect all the dots: prevalence, examination, treatment, TheraX, modalities, patient education, all the dots connected for the key guideline-based patterns. And then we reproduce that model for every body region. I use that app every week to drive context for all the little pieces that I'm throwing out there in their labs. They see all those pieces in context based on clinical patterns at the beginning of the week. They know exactly where we're headed with all of those techniques. They know exactly which condition this test is for, or this intervention strategy is for which condition. So we're a growing group of faculty and clinical experts. Most of these people are either in universities as faculty or in leadership positions in residencies and fellowships. And we continue to grow based on the needs of the faculty and serving the students. So a lot of these are my colleagues, they're colleagues from other universities. And it's really been a privilege actually to be a part of the creative side of all faculty members and really leveraging our technology team to build cool stuff. The last thing I would say here is just that last year was the beginning of our PhysioU JOSPT partnership. And so PhysioU, because all of our apps are guideline-based, have all the videos that are connected to the clinical practice guidelines as published by JOSPT. In fact, they are about to put out a special feature related to return to sport, upper extremity. PhysioU filmed all the videos for those articles because we think the future of learning through research does not just have to be black and white pictures. We hope that eventually all the techniques that have been researched will be able to see videos of, and PhysioU is completely invested in making that happen. So yeah, we're excited about that. So I want to share with you what PhysioU apps are currently available and a little glimpse of what PhysioU is, and then to talk about 3 simple ways to leverage PhysioU into your interactive online classroom. And, you know, if we are so lucky to be back in the classroom in fall, I would be using it the exact same way. So I learned a lot of cool little things about being forced online, on how to use the videos as a way to create, I think of it as graded exposure. Students should not see the technique for the first time when they're in lab with me. I would like them to watch the techniques and try some of the techniques before they even get into class with me. So I really think motor learning is a graded experience. So what is PhysioU? Well, we used to be natively on iPads and Google Play devices, Android devices. We decided to completely centralize on a web-based platform for 2 main reasons. One is it became impossible to update all of the apps as individual modules in every platform. And secondarily, many of the app store's rules and restrictions make it very difficult for us to try new things, to use new technology. I mean, we're building a neuroanatomy app that will be the neuroanatomy app of the future. It's incredible. This is some work with a colleague from Augusta University, and it will change the game on how we understand neuroanatomy and the impact of lesions on human movement. So we'll have real patients to demonstrate how lesions look. So it is a web-based platform. It's a one-stop shop for a lot of the content that a PT program or a PTA program needs. So you can see that we slowly got faster region by region. And when we were done building all the orthopedic apps, we started going after low-hanging fruit that we thought, man, no one loves to read about range of motion MMT. If they could just watch a video, they would already know how to do this. So there's your range of motion manual muscle test app. Then we said, hey, let's do a gait analysis. Let's do a gait app. Let's do a neuro exam app. Let's do a cardiopulmonary rehab app. This is the orthopedic apps all together. So this is clinical pattern recognition orthopedics. Then we said, hey, no one really wants to read about gait patterns. Why don't we film all the gait patterns with all the assisted devices? Why don't we film all the PNF techniques with some of our alumni who are now teaching at Kaiser Vallejo? Let's create tools to help students do patient education, right? Here is an exercise patterns app. It's taken us a long time to get it ready. We are actually playing with it right now in our development platform. It includes guideline-based exercise progressions for the most common guideline-based conditions, plus all the common post-op. So we have protocols that we have consolidated from some of the top resources, and we've created a general protocol. Every protocol looks the same, which is the challenge when we look for protocols online. They all look a little bit different. We've taken all the best protocols and made a judgment call to organize it in a standardized format, of which many of those exercises and interventions are all linked because we filmed all of those exercises, interventions, modalities. We filmed them all. So if you can think of it as a living protocol, so to speak, it's going to be quite a useful app. This will probably be out, a couple weeks, maybe about a couple weeks. Yeah. And then you can see 2019 plus, we filmed a lot of things related to splinting. We filmed an app related to rude technique, even though we know rude technique isn't heavily taught anymore. But one of our friends and professors, Dr. D. Lilly, we thought, you know what, she's here, she's eager. Why don't we film it? We should capture it. This is part of our legacy. We filmed dance movement. We're filming human movement. We filmed developmental milestones. And so I'll give you a glimpse into a lot of these different apps. But to kind of cluster them based on interest area, and these are the same reasons why I polled you, is we have a set that I think are kind of first year apps, fundamental clinical skills, modalities. Our entire modalities class was run with our modalities app. How the techniques are performed, there's videos of it, there's contraindications and precautions, there's all the settings, they're all set up in this app. Here is our assisted devices. I'll show you a glimpse into that. Range of motion MMT. This is Gait, our gait analysis app. And then we also just released a virtual reality gait analysis game. So students can start applying what they learned here in Gait into pediatric gait. And we used the Edinburgh Visual Gait Score to have students play through gait analysis. Here is Neuro. So Neuro has Neuro exam. Every test you will teach for the Neuro exam, from diagnosis specific, vestibular, stroke, stroke or brain, Asia, spinal cord, PNF. Here you have Neuro Rehab, the Neuro Rehab app that covers the bulk of the interventions. And then the neuroanatomy app, I suspect we're still about 3 to 6 months out. There's a lot of content we're collecting on real patients to demonstrate what lesions at different levels or different areas of the brain, how they present. And then here again, you see gait, you see functional movement. We have filmed a lot of functional movements that we will then be able to use as examples for analysis to talk about what joints move first during forward bend, what joints move first or in what sequence during sit to stand. So we have that coming along. And then pediatrics, we have developmental milestones where we followed the same baby. We followed the same baby for 12 months and filmed all of his development in supine, prone, sitting, and all of these different, as he continued to develop all these different positions. And then the virtual reality gait analysis. Here's ortho. So we've got a whole collection of the orthopedic apps. Pretty much every common condition, musculoskeletal condition, have all been patterned out. What is the common exam? What's the prevalence? What are the common movement faults that drive the pathology? What are the special tests? What are the rehab strategies and interventions? Whether that's manual therapy or therapeutic exercises or modalities even, it's all linked. And then we have a special test specific app. We're working on a medical screening app. And then there's patient education, exercise patterns, and then some functional movement and splinting. And then for the acute care cardiopulmonary region, we have lines and tubes, a reference app, adaptive equipment or assistive devices, including going up and down stairs, fitting wheelchairs, propulsion. And then we have the cardiopulmonary rehab app, which is really pattern-based again. So I'll show you those. So what you see then is really a group of apps for the main content areas that we hope are useful for faculty in the classroom and for the students. One resource in their pocket where they can access all of these different apps anytime they need to. Excuse me 1 second. Okay.
Dr. Wong,
Yes.
can I chime in for a second?
Yes, please.
Yeah, you know, I get to listen to Dr. Wong do this many times, and there's a couple of things that I'd like to emphasize, and that is, you know, when I first started using this app many years ago was with the gait, and he mentioned how on YouTube you find videos as an educator I like, and then the next time I teach the class, it's gone. And so there's kind of a standardization of information here. When I taught ortho, you know, the students would come with some different technique or some else, and they go, well, I found it on the net. And it's like, well, you know, we have to have some kind of standardization of information, kind of a base platform to go with. And I love the conversation in class about a variation to it, whether it be, you know, in manual muscle testing, hand positioning, patient positioning, whatever. And then we have that discussion, because what I think it does, it teaches the student to think, not just to memorize the old, you give a man a fish, you feed him for a day, but you teach him how to fish, you feed him for a lifetime. And that's what I think this app does a lot. So it really helps facilitate critical thinking. And I don't know if Dr. Wong's going to go through any of the ortho apps where, you know, the evidence base behind it and the references behind it. This is not stuff that, you know, a bunch of guys got together at a pizza parlor and decided this what the information would be. It's, you know, the clinical practice guidelines, and you can share, Dr. Wong, your involvement in establishing that with JOSPT, maybe at later slides or right now. So I think this is a very helpful tool. Not just a repository of information, but actually a teaching critical thinking tutorial for the students to learn how to think through and problem solve.
Yeah, you know, the Gate app was one of our early apps, and it was me trying to reimagine how can we teach a profession that is supposed to be the movement specialist. How can we create tools to help them learn about movement better? And really, that experiment, this is really just a template for what we're building for the functional movement app. The functional movement app has range of motion sensors and EMG sensors for the key muscles that I want to tell a story about when it comes to sit to stand, to squat, to forward bend, return from bend, a lot of the common functional movements. And so gait, of course, being very well studied, we thought we could become an adjunct to the classroom so that many of the videos are now in the pockets and in the hands of the faculty, so that when you look at deviations, let's say hip abduction, we can now never have to spend a minute on YouTube anymore. I can just open the app, have the students watch the videos together, and then talk about the associated phase, the potential cause. I love the potential cause because it links to something they might have just studied about measuring hip or knee flexion or MMT of certain muscles. You can drive so many interesting conversations about what would you do to help this patient perhaps, right? So that is the Gait app. And this app also includes a number of deviations for prosthetic gait as well. And so you have a number of different videos where you can now look at common prosthetic gait deviations. There's above knee and below knee. So here is knee instability. And really, some potential causes. What's the penalty? Something to talk about with prosthetist. So you can see that our movement app is really just going to be very similar to this. There's going to be critical events. So there's going to be a lot of different functional movements with different phases of the movement, range of motion at different joints, muscle activity, and critical events. It's the same model, except now you'll be able to talk about movement in a very simplified way. All right, so let me move on here. So the three main challenges that I wanted to mention. So one was motor skill development. Honestly, when fall came around and we knew that we were going to be all online for a lot of fall, it was quite stressful. Now, thankfully, pretty much everything that I teach in lab is already filmed, which means what we did for our class, well, let me talk, I'll share with you what we did for our class. First, let me just say motor skill development was big on my mind because particularly in ortho, there's so many manual skills. How in the world were we going to teach them all of this? The second thing is, how do you create engagement in your online classroom? It's not easy. So we built a lot of case studies that you could leverage into your little Zoom breakout rooms so they could interact with one another, so they could kind of stretch their legs and use some of the knowledge that they're gaining. And then how do you develop big picture context as a scaffold for deep learning? And I'll share that with you, how I do that in my orthopedic class. And I know how my chair does it in her cardiopulmonary class. Well, we did a little bit of a lit review related to motor skill development. And we found the nurses actually have published quite a bit about this. What I'm encouraged by here is that, let me go back here. It says, the evidence suggests that online learning for teaching clinical skills is no less effective than traditional means, meaning that there's hope that if we have the right resources and we deploy them in a reasonable way, we could do as good a job as when we were just face-to-face. In this article here, they talked about how these short video clips, this is a mobile app, one of the lead mobile apps that came out much earlier than we did. They had a bunch of special tests that were filmed. It was perceived that these downloadable videos, or these videos viewed and downloaded on the mobile device, were perceived as highly valuable in learning orthopedic special tests. The convenience and flexibility, right? So that's what I think apps can do that textbooks cannot do. And that is organize information in an infinitely easier way to access. So here's a lab handout. This is from Dr. Young. He's one of the founders. And in his lab handout, you can see that all the techniques have hyperlinks. And these hyperlinks will actually take them directly into the PhysioU apps where they can watch the different techniques. So what we did in our classroom, so actually, I'm going to show you this here. We have created, so if I go here to PhysioU.health, under Educator, Faculty Resources, we have teaching content. Under teaching content, for example, we have a bunch of lab handouts that we've created for you. So for example, a number of you are teaching your range of motion MMT class. So here, we have created the lab handout for your shoulder lab in a Word doc or a PDF, which means you can download that Word doc. Let me just show you the PDF version for now. You can download that Word doc and get rid of or add anything you want. We've just put down the basic stuff that we think generally everybody needs. So in this app, there's palpation of bony landmarks and soft tissue for the shoulder. So the students this year, actually they're doing this class right now, they know that before they come to class, their job is to palpate bony landmarks are on themselves or on someone else that they live with, bony and soft tissue landmarks. It's all asynchronous. So they read the instructions, they click on the link, they watch the video.
When palpating for the coracoid process, the coracoid process is an attachment for the pectoralis muscles. So the best way to palpate is to horizontally adduct the patient so as to put those structures on slack.
They practice all of this on their own. We don't spend a minute on it. So the entire lab, they basically go through and run through the soft tissue palpation, the bony palpation. And then when we get to the range of motion MMT part, so I'm just scrolling down a little bit here. Here is my range of motion. Patient position, stabilization, testing motion, normal end feels and landmarks. So here are the landmarks and the normal ranges of motion and the video. The entire range of motion, manual muscle test, basic neuro exam, and palpation are all here in your range of motion MMT app. Now, a lot of people ask, which textbooks did you reference? We were previously at our university using Nancy Berryman-Reese for MMT and then Norkin and White for range of motion. But as faculty have requested more techniques because they use different MMT positions for, let's say, grades 0, gravity minimized positions, we just filmed alternatives. And so we have pretty much covered, or if we haven't covered it, just email us and we will just continue to add to the collection, basically all the common range of motion, MMT, and palpation techniques from every textbook. Okay, so just so you know, the original text that we were using in our program was Norkin and White for range of motion, and then manual muscle test was Nancy Berryman-Reese, which, I mean, they're fantastic textbooks.
Dr. Wong, can I make a quick comment real quick?
Yeah, please.
Yeah, the beauty of this too, I think, is that this information is with the students forever. And so later on in their curriculum, you're looking at an acute injury, like a sports physical therapy injury. And so an AC separation, the corticoclavicular ligament is going to be traumatized. So, oh boy, I got to remember where to palpate the coracoid process. Boom. They just go back, look it up real quick. They're there again. The gait app, person's got foot drop, whether it be due to a spinal cord injury, a back injury, whether it be Charcot-Marie tooth disease or any kind of neurological thing, oh gosh, how do I go back and muscle test the anterior tib and things like that? So I think they have this very much quickly to go back, refresh, boom, come right back. And so it's kind of the good basis of them for them to have that continual review, and at the same time they're studying for their board exam as they do this, and it just shows application. So I think if the curriculum at large uses the app, there's tons of support material for the subsequent clinical classes from the basic science stuff.
Right. And you can see, even in something as simple as MMT of the shoulder flexion, we have carefully put what we think links it nicely to their anatomy class that they're typically taking at the same time. And we've tried to make a connection to occupation and function, right? You're measuring this in your patient because many times they're telling you there are certain things that they can't do when they don't have enough shoulder flexion, right? So I think you can see we're trying to cross many boundaries that are typically barriers to integrating the material. Any comments or questions before I move on?
Chat room's empty right now.
Okay, good.
But I think in one word would just summarize what you said there. Contextual learning. It's not just memorize the information and then I'll guess where it applies later. No, you can see how it applies now and continue on as you go through.
Right. So under the teaching content, if you look at the lab handouts, we have lab handouts for all of PNF, lab handouts for all the assistive devices. That means gait training, assistive device fitting, getting up and down stairs. What else do we have? Transfers, wheelchair, bed mobility. I mean, these worksheets are all filled out, are already created for you, actually, with all the videos linked. If you look at neuro exam, for example, all of your neuro exam lab already created for you. So here's your PhysioU neuro exam. Here's all your balance test, all linked. Okay. I mean, it's a massive document, but that's why we put the Word document there, because then you can use it. We're happy to try to make everybody's lives easier, right? So actually, while we're talking about Neuro, just for a second, let me just give you a glimpse. So if I come into the Neuro app, so one of my colleagues, actually, Kathy Kumagai Shimamura, recently passed away. She was a sister, a great friend and a great professor. And she said, Mike, when we teach this class, we have hundreds of pages in a binder of tests and measures that no one wants to read. Could we film all of this? And so that's what we do. Before balance week, the students know to watch a bunch of these balance tests on their own first. And then when we get to class, we don't even have to worry about setup. We can play the video. The instructor can talk about the test. And then the students take their apps and they go practice together. It's so fast and so efficient that it's made teaching Neuro so much easier, right? So you have all of the setup, the equipment that you need, the things that you would say, how you make interpretations for fall risk, and your references, right? So this app, for those of you who mentioned that you're interested in Neuro, will cover everything from motor control. There's always an introduction. Here, this is Rachel Tabak-Tran. She's currently the director of oncology residency at City of Hope nearby here. You've got all of your sensation testing, tone testing. You have all of your gait measures, DGI, FGA, Fullerton Advanced Balance, HIMAT. You've got all of your diagnosis specific, Fugl-Meyer and Stream. Everything is filmed for you. They come to class pre-exposed, graded exposure. How much easier it is to now talk them through it or have them begin to practice on their own, where you can now spend time helping them reason through why they are doing these different tests. Right, so here is spinal cord injury, Asia motor and sensory. And I think lastly, I will just show you that we have vestibular and cranial nerve exam. Everything's here for you. Okay, so that's the Neuro exam app. And really, I think I might as well show you neuromuscular rehab. This is in our partnership with Medical University of South Carolina and Dr. Sarah Kraft. She filmed a full evaluation. So you get to have students, the way she uses it in her class, the students watch the history and they take a little mini quiz while they're watching the interview. And then they answer questions. And when they choose the right answer, they move on. When they choose the wrong answer, they actually get told why it's not the right answer. So they're going to learn asynchronously. So they watch the full eval. You can see that goes all the way to gait observation, no shoes, no brace, and they have their little quiz questions. So this is how she starts her class. They watch the full evaluation. Then she has a bunch of interventions. So all your common interventions that you would teach are all organized here. So certainly there's a little bit of overlap with the PNF app, but this covers pretty much all of your common interventions. And right now we are working together to update her video library related to the case studies. So you have a number of different patients here that you can use. They're just glimpses of different parts of the intervention or the evaluation. And they are basically things that she uses to discuss in class. All right. And then let me think, is there the other, you know what? I think this is a good place just to talk a little bit about the PEDS app. Here is developmental milestones. So here's your motor milestones. So besides month 0, month 1 through 12 are all the same baby. Okay, so you get to watch how this child changes prone, supine, supported sitting, and to talk about the observations you would see, the atypical development. These are all videos, of course. And to follow baby Blair throughout the months. So we've put it all there for you to make it easy for you to teach this content. You can also see that the reflexes, all the common reflexes have been filmed for you. And when it comes to standardized testing, what we've tried to do is organize the standardized testing. Granted, many of these tools, or pretty much all of them, are proprietary. So what we've done is we've organized it by diagnosis. So here are the common tools you may choose to use. Here's the TIMP. Here's what it's for. Here's the age group. Here's the psychometrics. And then we can link you to the instrument so that they can purchase it, or they can get more information from the Shirley Ryan Abilities Lab, which is always the most updated resource. Right? So we've tried to at least organize it in a simple and clean way for faculty to access. And we've created little case studies. So actually we have a team who is getting ready to film. It is a PT, an OT, and a speech language pathologist, all examining and treating the same child so that we can begin to learn about the interprofessional contributions of each profession in the well-being and rehabilitation of a child. And so we will be filming, that's the Pediatric Interventions app, as well as we're using those as samples for students to begin to watch and learn from the clinical reasoning of the different clinicians. So it's a big project, but I think it's very much needed. It'd be useful to have some of these sample evaluations of different types of diagnoses. Okay, so that's Developmental Milestones app. And there are case studies available. So short case studies of different children that you can use. The answers are hidden. So really, the goal is to ask the students to basically watch the video and try to determine what they see, what they think the functional age is. Then they can reveal the answers, and you can talk about the short-term goals and long-term goals related to this child. So these are the different things that you can see. So again, we hope that this becomes a useful tool for you for all these different positions with different babies in there. Okay. Any comments or thoughts related to this, the kind of neuro component of the PhysioU apps?
Jessica asked a question in the chat, Mike, about how successful were you at getting students to do their pre-lab activities with the app?
So the secret about the app is, in the end, it's just another one of a million apps on their phone, and it's far less interesting than Instagram and all their other little cool little games. But from the very beginning of ortho, and regularly throughout ortho, there's a reminder about a system of learning. And I tell them that over the 18 years of teaching, one of the common comments from students related to lab is, it feels like it moves too fast. I can't keep up. I'm busy writing notes. And so I share with them that story and how there is now a process to learn these skills and where that process what that process leads to. And so there is a reminder almost, I would say, every couple of weeks, one, that they need to go and do their clinical pattern recognition worksheet. So before they come to class, they come and they do these worksheets. So let's say shoulder week. The shoulder week worksheets essentially has the most common patterns shoulder impingement, unstable shoulder, frozen shoulder, and then AC joint sprain, and then a differential of thoracic outlet syndrome. And they basically fill these out on their own because it's a walking tour of that pattern. What are the common movement faults? What are the common key findings? What are the examination strategies that you're going to use for this problem? What are the common associated impairments? Everything's linked to within the app. Their job is to do that because I've told them by pre-exposing themselves to the techniques, which are also related to the lab handout that they get early before class, all of these pieces work together so that when we come to lab official, they have seen the techniques at least twice, 1 from this worksheet, 2 from the lab handout, and then 3, when I'm online with them during our sync session, I'm actually playing my app out. I'm talking to them about these common patterns related to shoulder problems. All of that exposure, I do it every week. I think there's a regularity that creates a habitual pattern of learning that I intentionally apply to them. And I think that it just becomes part of their habit. So we've been pretty successful at doing it because they recognize by the time we get to lab, they learn so much better and deeper because they have pre-exposed themselves multiple times to the techniques from a contextual side, which is learning the pattern, to all the way to, just trying the techniques out, looking at the lab handout and looking at the videos. So it's been fairly effective. But I think it needs to be intentionally revisited. And the students need to see the faculty wield the tool. It's like any textbook that we don't use well. If we don't use it a lot, we don't enforce it, we don't share with them the value related to it, they just have other things to do. I don't know if that helps.
The other question is from Laura Sage. And Laura, if you want to unmute, you can help explain the question you have in terms of PNF, and that it's very supine positioned, kind of heavy.
Yeah.
And she has her students mainly respond in any kind of way with those techniques that way. And I was wondering if it has come up before for you of PNF and other. I mean, I think when I do my trunk and my shoulder girdle patterns, I'll see they're side lying.
Right.
But yeah, so I don't know, Laura, if you want to elaborate further on your question.
Yeah, Lori, do you mind elaborating?
Sure. I just, I hadn't realized that we probably needed to spend time in lab having them brainstorm about how they would do it in the prone progression, higher level kind of thing, other options. I was testing the 3rd and 4th student, and I'm getting the same patterns. I mean, they learned their PNF, they knew the different indications, but when it came time to picking an exercise, I finally had to say, okay, we were testing like 2 or 3, and I said, okay, only 1 can be supine. And they said, well, that's how we saw it on the videos, was in supine. So I didn't know if that, so that's how it was running through their heads there.
Yeah. Laura, that would be a great conversation for me to take up with you, because I'm wondering, I'm not the one who built the app, of course, but I'm the Amy who works at Kaiser Vallejo. I think she'd be excited to hear that feedback. And then we could begin to think, I wonder if that's partly just the creativity side, that we need to encourage students to say, hey, here's the baseline, and you're going to have to modify based on the patient's ability or what you're trying to achieve. So that might be one of the considerations, that which I'm sure you're already doing. And maybe in a future version, a future update, we are able to film some alternative positions for certain activities. Is that what you're kind of asking about?
Pretty much, yes. Thank you.
Okay, got it. Yeah. James, do you mind? Let's try to reach out to Laura so we can get more details, so I can pass it on to Amy.
What program are you with, Laura?
We are at San Marcos PIMA PA program.
Yep, I'm familiar with it.
Oh,
yep.
Awesome. Okay, got it. Great.
Thank you.
You're welcome. Great comment. You know, I want to show you a little bit of the Acute Care Cardiopulmonary app. So this app actually fits very closely to the orthopedic app, meaning for lab, these quick access panels essentially are all the physical exam techniques that we're going to teach in a cardiopulm class. Okay, so here's all your techniques. Here are all your intervention techniques. Here is all your intervention techniques. So essentially, this is our lab handout. But the cool thing about this app is we've also created the common patterns. So here's all diagnosis. Here are your main cardiovascular, cardiopulmonary conditions. And when you go in, you get to watch a video of the patient telling her story about her signs and symptoms, right? So here are some risk factors, some common findings. Here's the clinical practice pattern. And you get to look at the associated outcome measures, functional performance measures, geriatric considerations. These are all hyperlinks to either techniques or questionnaires. And the basic subjective exam. This is a generic subjective exam, so you can see the person doesn't match, but the students learn by mimicking what is the general questions that a cardiopulm specialist asks of the patient. And actually, sorry, I'll go back to here, and here are the components. So in fact, my chair had me sit in on a redo exam. She said, Mike, I know you've never done a cardiopulm exam. Make sure the students ask the question in the same order, and these are the key questions. Just follow the app. And that's how I was the second grader, just following the list. And then in the interventions, here's the physical exam. There's a clinical reasoning video, a key findings video, a chart review, how you do a medical chart review, and then the objective tests. So certain tests will be part of certain condition. Some of the tests will be part of every condition. But that's kind of how we create the context for the patient related to the most common patterns. You can imagine when we go to test them, they have cases that are one of these 5 cases. And we expect to see the basic exam and the basic interventions that are laid out in the app. So that's the cardiopulm app. And that really ties to the lines and tubes here as a quick reference guide. So here are your common lines and tubes and drainage, what they're for, the purpose, the placement, the indications, the clinical implications. In fact, we've created worksheets because clinical instructors are like, oh, this is so useful. So now we have a clinical worksheet. So if I go here under educator clinical education, there's some worksheets here, lines and tubes. Every week, take one of your most complex patients, fill out the lines and tubes that you see, the purpose, and the implications. Let's discuss it. So this is just a piece of homework that a CI can utilize every week. They do the same thing with the pharmacology app. So here under, let me go back, there are pharmacology worksheets. Every week, take one of your patients, fill in the medications, and use the PhysioU app to look up the medication, talk about what's the brand and generic names, the class, what's the purpose, what are some precautions and side effects. They can just go directly into the app here. Here's the pharmacology app. My patient's taking ibuprofen. There it is. Common name, common category, the adverse reactions common as well as serious, and then your implications for rehab. Right, so the most common medications are there. The pharmacist that we're working with, she just finished the herbal supplements component. So the common questions we get related to St. John's wort or chondroitin, stuff like that. So there will be a new section that will update into the app. So that covers, I didn't show assisted devices. This is just a few slides to show you assisted devices. It includes, of course, all this assisted device fitting. So all of our students watch this before they come to lab, and then they get to work. We don't even have to teach it to them.
Michael?
Yep.
Charlene Jensen asked a couple comments real quick, and then
Sure.
later on I'll get to Mr. Burns. Bracing. It sounds it's close to this crutch stuff and the assisted device, but bracing that she's found that students were encountering in the NPT exam prep, that they're talking about bracing, airplane splints, any type of bracing. And I think you already addressed the wound care stuff. She also asked about that, but I think you mentioned or showed some pictures on that already.
So we finished filming. We're in the process of finishing up an acute care app. I'm not sure if this is the kind of bracing you're talking about, but we've got quick draw LSO, lumbar corset, knee immobilizer, Jewett brace, halo traction vest. So we have all of these donning, doffing, and overview. So we have videos for all of these now.
This is your lumbar corset brace that's flexible. This one will have, most of them will have a tag, and that'll be the back top.
And so we have videos of all of these common acute care braces. I don't know whether you're talking more about knee and, more of the musculoskeletal versus the acute care. But just so you know, we filmed all of the bracing, we filmed PPE, and I'm now working with a colleague, Jennifer Nash at UNLV, as we begin to think through all the case studies, because we filmed a bunch of case studies, acute care case studies, full evaluation or full treatment sessions of these different types of patients. So there's a ton of stuff that we filmed that we're just figuring out best how to organize it and deliver it to you in a useful way. But I kind of digressed away from the bracing, James.
Yeah, and maybe Charlene, you can chime on, unmute yourself and ask. But while we're waiting for that, Bob Burns writes that is there any way to limit access to certain parts of the app? He's not in a PTA program; he's in a Kines program, and or Bob, you may want to Rob, you may want to unmute yourself and ask your question if I'm not representing it well.
Yeah, I would just say, actually, this afternoon I have a call with my colleague Adam. He teaches in a Kines program at Pepperdine. We're talking about filming a physical. Sorry, I can't even remember it right now. It's exercise testing. All the exercise testing. We're going to film all of it, and his program primarily only uses components of the app. Now, Bob, I'm happy to chat with you offline about exactly which apps that you would want for your Kines program. Most of the time, the faculty just have the students get PhysioU. They use the Gait app, they use a range of motion app, they use different parts of the different apps. But certainly we can talk more about what is the package that Kines programs need, So I'm happy to actually, if you don't mind shooting me an email at mike@physiou.com, I'd be happy to jump on and chat further with you about that. So I just want to show you that for all of the gait patterns, for all of the assisted devices, we filmed both right and left lower extremity. So you can see the red stocking, partly because the students learn by watching, but eventually they use this same video to teach patients, and they can click the send button and send the same video directly to the patient's email, as well as taking them directly in to show them how to get up and down the stairs. So all of this particular app covers, right? Here is stairs with crutches, right extremity, non-weight bearing. Here's how you go up. Here's how you go down. I can just share this page to me, Mike at PhysioU. and the patients get all of these videos. They don't have to subscribe. It's just a patient education video. So this app will contain then bed mobility, sit to stand and stand to sit with various devices, your basic transfers, and all of your wheelchair fitting components, propulsion, pressure relief. All of these you can just email to the patients. We also, in a lot of the apps I want to show you, have case studies. So here's your patient coming in. Here's the brief case study. Please answer these. So we purposely put these here because there's no better way to help the students really sink this information deep into their brain than to really just have them go into Zoom breakout rooms, and discuss this. Of course, the answers are here, but we tell them not to look at any of the answers. And in a future version of the app, only the faculty members, when they log in, will the answers be available. So there's case studies in the GATE app, in the CardioPalm app, in this assisted devices and lines and tubes app. So there's a lot of little ways for you to integrate this into your classroom. So I know we're getting late on time. I just want to finish up here by saying that, yes, our Physical Agents app was a hit with the students this year. It basically made it so that they could play with any of the physical agents and learn about the application of lumbar traction by just watching a video of me setting it up, or looking at a high-speed video where you as faculty could just narrate what you want to say. So this is the high-speed video. The video version is a regular speed narrated version. And then there's step-by-step pictures. All of this is tied to contraindications and precautions, as well as the settings. So here is your setup, the setup information here, along with the settings for your different, for your different purposes. All your references here. We did a new lit review actually before we released the app. And so you can see that pretty much all of modalities is covered. Here's all your phaso-pneumatic devices, your eStim. Okay. So, man, there are more apps here than I can finish talking about in an hour. So I apologize for going long. I was just going to say that for those of you who are interested, I have another set of webinars that goes deeper into the different sets, like orthopedics, like neuro, like cardiopalm. So I take you deeper into those apps and how faculty are using them. I would just say in closing that we're being used in many, I would say in a good 2/3 of the universities in the United States, in the programs in the United States. We are cognizant of the cost. The faculty always ask, how much is it? It's $54 per year. This is the time to get it for the students. I mean, it's really $4.50 a month. I mean, it's cheaper than what they buy every day at Starbucks. Faculty have full access. You guys can always use it as you need. We're happy to support our faculty colleagues. But at the end of this year, this price will be going up because we're releasing an entire new platform that includes all of these simulations, all of these evaluations that are interactive evaluations. They will be able to watch a patient, put down their reflections, and then see what a clinical specialist was thinking based on those same key trigger questions. So there's a lot of really cool stuff that we're building. It really ties to a lot of these simulations, these kind of choose your own adventure simulations that we've been building. And we're building them with both PT and PTA faculty. So the PTAs make decisions a little bit different, of course. And we think this is a very important hole to fill for our students to develop into clinicians. So I think the last thing I would just say is, please look out for for the deep dive webinars, we already have these pre-recorded, but if you want to attend one live with me, if you go to our website and look under faculty resources, you'll see all of these that you can register for. So March 18, I'll be talking about the range of motion MMT app. I'll be talking about the GATE app and assisted devices app. So I'll be talking specifically about these year 1 classes. And then here's Neuro and Peds on 4/22. And so there will be more coming out in the next few months. And please feel free to email me anytime. If you have ideas, if you have thoughts, if you have comments about things that you need in the apps, or you just want a little more of a one-on-one to talk through how to use the apps in the classroom, both James and I are available anytime to meet with you. So I'd like to, for those of you who are still remaining, I'd love to just open it up for some comments or questions. Any comments or questions, thoughts?
Charlene, you made a comment in the chat that you use the modalities video. Maybe you can tell us how easy or how hard, difficult it was for you to integrate into your program and how the students responded.
Yeah, I'm using it right now because we're teaching modalities this semester. I like it because instead of me coming in and demonstrating every single modality, how to set it up, because the students are always like, well, how do I educate the patient? Instead of me having to do all of that, they can come in already prepared for it, and it makes better utilization of the lab time.
Absolutely.
And so they're watching the video on how to do laser, how to do traction, and I think it makes my labs go much smoother. The other thing is things such as diathermy. We don't have a diathermy unit, and that's in our area. There's only 2 clinics that we know of that have diathermy. They're both, one's a PACE center and one is a nursing home. And so it's very unlikely that our students will encounter it, but I want them to see it. So I also like the fact that I don't have to purchase a $10,000, $15,000 piece of equipment because they're not very likely to encounter it, but they can still see it and they can see the actual piece of equipment being set up. And that's something that I have been searching for. You can't find diathermy videos that are new. Some of the pictures are really old. They're the super old coils that you lay on the patient with the towel between them and the coils. And, you know, unless they're getting a piece of equipment from the 1980s, which probably no longer will pass inspection, they're not going to see that. So I do like the videos for that because it's current. And it kind of, I think in a nice clean place shows the reason why we ask the survey questions or the questions when we're clearing the patient. It says, okay, well, we're going to ask about DVTs, and this is why, because this is the pathology we're trying to clear, which makes it, and it's PTA students, so it definitely helps them understand the why. Since they're not doing the evaluation, they still need to know, they have to ask the question. Even though the PT should have cleared that, it doesn't mean that it was cleared. It doesn't mean that something didn't change. And so I do like the videos for that purpose, for this particular content. The other thing we use is the motor milestones and the reflexes in the Neuro Peds course, because it's a great way for them to see the movement, because you can't bring kids in, unfortunately, especially with COVID. We used to have someone bring in infants so that they could see some of that, but the videos definitely are kind of filling that void that we don't have the ability to do right now.
Yeah, that's great. And Charlene, I would say that we are almost finished building a bunch of mini games. They're basically patient scenarios that ask students to choose the right contraindications and precautions, choose the right patient position, choose the right settings, apply the modality to the, apply the pads to the right location, these little games that then our students, we can leverage to help the students really apply the information, right? So delivering the content's one thing, applying it in a clinical based situation is the next stepping stone so that they can actually know when to make the right decisions. So those will be coming out in this. We had to build a whole new platform because we want to be able to look at the decisions that the students made and to get a summary of where were the mistakes or the thought viruses where they made mistakes. So all of that will be coming. So thank you. Other questions or comments?
I would say a comment, I would say a comment regarding, do students prepare for labs? I think that I would agree with Michael. I've found some ways to set that up. What we've done this semester is we've created a lab prep sheet and then a lab application sheet. That's just a simplified version of essentially the lab document. And so they can use that supplementally, but they can click on that and go through it. And then I would say there's times that I put the fear of God in them by just telling them that they're going to be on the spot, that I might ask them to demonstrate a skill in front of people, and that just keeps them on their toes. And then we just repeatedly, I think it's made the labs, I agree that the labs are more efficient. They are more prepared. I think the students are more engaged. We do a review of 3 to 5 techniques at the beginning of a lab, each session that we are able to have, and then we move on. And I think the advantage to it allows, as kind of was alluded to, is it allows students to progress as quickly or as slowly as they need to do during that allotted time. If they have goniometry down, but they can't figure out palpation of the carpal bones, it's like, well, fine, palpate the carpals on your partner. You don't have to spend the time on a goniometry. The one suggestion that came from students just this last week was if they could have they kind of lose focus. When there's video, they kind of lose focus of where are my hands supposed to be, right? They focus on the video and the movement, and then they forget the landmarks for goniometry, etc. So I don't know if there's a way to pause static the video because the landmarks are already there in the video. But in the future, if there's a way to actually just put that on the front end, here's your landmarks before he starts talking about it, they get carried away with watching the movement and then they lose track of what's going on.
I mean, we usually at the front end of the page. Oh, and sorry, I'm not sharing screen, but let me share screen for a second. At the front, we always took a screenshot of the end position and the landmarks are kind of showing. So right. In general, we've tried to do that. I don't know how, could you tell me a little bit more about what you mean in terms of stopping the video? I mean, certainly you could stop the video at any point, but that's what we tried to do with this initial picture.
This kind of comes down to, there's always going to be a student that says that doesn't work for me. Could you do it one more way, right?
Yeah, right.
So I think it's good the way it is.
Yeah, we could always talk about that. I mean, there's only so many things that we can do, but if that is a big enough issue, absolutely, we can think of new solutions.
Or just putting a static image of the landmarks below. But for me, it's like, it's all there. I tell them it's all there. It's like, you just need to watch it one more time.
Right.
The information is there. It's all there. I don't remember, is there handheld dynamometry? I know there's grip strength, grip dynamometry.
Yeah.
I'm talking more about, testing, whether it's the quads or the shoulder. If there's not.
Yeah, that's definitely something that we could think about adding in. Let me just see. I don't think we used handheld dynamometry, but certainly in the orthopedic app, there is some dynamometry. Let's see. Yeah, some in the orthopedic app, there's definitely some, but they're not part of the MMT app per se. And that's certainly something we can look into adding in. I mean, it's really the same technique, right? It's just that the handheld dynamometer is being used.
Right.
So yeah, it's a good point.
And then the last thing would maybe be is, you know, the clinical value of like maybe the special tests. You know, I know the sensitivity and specificity, but even if it was just like, you know, this is a weak, you know, weak clinical value, moderate clinical value.
Yeah. So like a rotator cuff
Where
drop, like a drop arm test.
Yeah.
So you mean
sometimes that
even this is hard to interpret for the students sometimes, is what you're saying.
Yeah, sometimes they like to, it's like, I know there are other resources, whether it's even in the textbook, like McGee will give it, you know, I think they red, yellow, green, as far as, you know, clinical value.
Got it. That's useful. Yeah. You know, one of the things we added in, let me see if it's here. Yeah, we added a nomogram. So whenever you want to, and you're trying to illustrate something related to likelihood ratios, let's say, you know, let's see if the belly press test has some likelihood ratios. Many times I will illustrate that by drawing, you know, drawing a line through the nomogram. So, I mean, there's little pieces that we've added in, but I like that idea. It'll be interesting to see how they make the determination of whether the clinical value. But it's a good idea, the different colors. It's something we can look into. Yeah.
Sounds good.
Great feedback.
It's all good though.
Yeah, thank you so much. Other comments?
Yeah.
Yeah, appreciate, Jeff, all the things that you're saying. Any other questions?
I would add the other thing that I emailed you the other day is it kind of where they really couldn't see the hand placement. I think, and I don't remember which technique it was. And I don't know if that can be a window of the video where it's like, oh, in the upper corner, can you have a close up of the hand placement where then you also see the bigger video of the technique being performed. And it might have been like.
The initial problem is that the closed captions can be turned off, as you can see. So that helps because so it's the accessibility requirements that make things sometimes less accessible.
Right.
But we spent a lot of money actually getting everything closed captioned. It can be turned on or off. In terms of another video here with a close-up of the handholds, it's something I can bring up to the team. It would take a lot of work to go through every single video because we'd have to re-render every video with a new inset video. So I have teased Marshall a little and said, hey, Marsh, it'd be kind of cool if you wore a GoPro on your forehead so we could see exactly from the first person view how you do a lumbar manipulation or how you do, so you can have options of different views.
Sure.
One future version will probably be that, which is what does it look like when you're doing the technique? And two, maybe we'll have another one where it's just a close-up of hand positions. So James, if you don't mind making a note about that, it's something for us to do maybe in the end of 2021 or 2022. But it's a good idea, Jeff. I like that.
What was that idea again, Mike, so I get it down accurately?
Oh, it's just a couple of different views, maybe a hand position view, maybe when the key point where the technique's being performed, it might be nice to get a close-up view, you know.
And that's for MMT or range of motion?
Well, it could be for really any of the manual techniques, I think.
Okay.
Yeah. So.
Yeah, I think the one that I was thinking of that came up the other day was like the Watson scaphoid test, where it's like it was really hard for them to know exactly where the application, even though they know where the scaphoid is, where the hand placement was, to really look at that.
Right. Okay, got it. Yeah, I mean that's about as close up as you can get. The only other option is really if you can hit a couple of different views.
On the radial side of the wrist. Purples take the wrist into flexion and radial deviation.
Yeah. You know,
right away, what they do is they lose, for lack of better words, they lose sight of where the hand placement was at the very beginning of the video. It's there.
Yeah.
But They just lose track.
They lose track of it.
Yeah.
Yeah. We'll have to think about it. I mean, it would take a lot of work. I mean, refilming a few of these videos, that's easy. But to put in a new view for every video is a 2022 project, really.
Yeah. It might even be helpful with some of those close up, like you described. I think you kind of said,
yeah.
Like, even if you have the textbook image right below the technique, right below the video where you have some of the other information. So it's like they could look at
that moment, the technique.
That moment, yeah.
Yeah, that's a cool idea. I like it.
I think what it does too is, Jeff, maybe you start with what's on the video from PhysioU, but again, and I always tell students this, don't go to a clinic as a student intern and say, well, that's the wrong way. Dr. Wong showed me this way. There's going to be knockoffs and variations. And so that's a great discussion where, why is this gravity eliminated a better position than, anti-gravity, and what the change, like Shreyas anterior muscle testing, instead of having them supine, you could do it in standing, but then you got to compensate for now it's not anti-gravity, and so your 2 and your 3 is a little bit different than it would if they're going truly against gravity. So and that's a good discussion for the students, just in terms of thinking, going through the thought process and stuff. And so again, you make them learn how to think, actually. So it's not it's a way, not the way to do it, but it's a good way to do it because of these reasons. There are other probably good ways to do it too. But, and then like for me, it's like for testing purposes, though, in my lab, we're doing it this way. Otherwise, you got a ton of stuff that they're going to start trying to show you and want to, get credit for.
I was going to say one of the things we did, because we've got an instructor in every pod, was we said every technique that we show is going to be benchmarked to the PhysioU technique, period. No one needs to show their cool little trick, because when it comes to practical exams, it's going to be a disaster. So everybody needs to see the same technique. That's one of the reasons why we use so many of the videos, even though we're showing the techniques and everybody's in the class, in their pods, we show the technique once with PhysioU. Then the students can call out which ones they want to see again with their individual instructor. But the individual instructor is benchmarked to the PhysioU video, which means there's consistency across 72 students. And that is kind of nice because that everybody wants to show their own little version. And when it comes down to the practical exams, they'll say, well, this teacher showed me this way, so you can't say I'm wrong. Well, no, everybody follows the PhysioU videos now. So that kind of helps. Any other comments? These are great comments. Any other thoughts or comments?
Yeah, I did. Thank you so much for doing this. I was really excited when I saw you talk about CardioPOEM because it's a very important system and often overlooked. I vaguely heard you mention about an acute care app. I think that's coming on, as well as some herbal implication. Is that correct?
Yes, that's right.
Okay.
So with the acute care app, what we're thinking about is, one, we're probably going to go and film in the ICU sim lab over at UNLV. So we're going to set up a bunch of scenarios. And I think the goal is, one, for students to be exposed to common situations and be asked to make decisions.
Absolutely.
And so I think that's what we're going to do for that. So a lot of the acute care, the basic acute care app, like I showed you, has these fundamental pieces, which is the common types of bracing that the students need to be able to take on, take off. And we also filmed a few error ones. So like, here's someone putting this brace on and it was terrible. Now, can you identify what the errors are? Right. So that's what we're doing with this. Here is the PPE videos, donning, doffing, and hand hygiene. And there is also, of course, what I mentioned, which is all these case studies. So the case studies essentially is we broke it up. Instead of watching a full 35-minute video, we just broke it up into each component piece so that we're actually going to create questions that help the students to deal with the situation.
Good morning, sir. Hello. Hi, my name's Jack. I'll be your physical therapist today.
So we might stop the video there and say, what equipment do you see in the room? You know, or based on the diagnosis, what are some things that you are already prepared about? And when the students enter their information, put their thoughts down, they hit submit, they can now see what Dr. Jackie thought about that same question. So that's one of the things that we're going to be doing with these different evaluations and treatments, is creating an interactive clinical reasoning development pathway related to acute care management. So,
that's what I was wondering, because I've already implemented a lot of the videos, but I feel like after semester 1, I would kind of be at a loss of options because it really doesn't transition to that next level of synthesization.
Right.
And so I'm loving what you're saying, because that's what I need my students to progress to. Like, okay, you have all of these components. Now what? Especially when it comes down to differential diagnosis. And then also like auscultation and ECGs. I think that would be the other thing. And I could definitely see you, adding that into those components, but that's great. That's what I wanted to hear. I'm excited.
And some of this ECG clinical reasoning development, you can use in the CardioPulm app under case studies. So example for her, they have her telling her story. Here is her basic case. And then we have a bunch of questions here that have the answers for now. We haven't been able to finish the faculty platform that means when faculty log in, all the answers are there for faculty. But for example, here you can say, hey, so you're preparing to exercise the patient. This is what you see at the ECG. What is your interpretation and should you proceed? And so they click on it and then they can kind of make an interpretation. And then later in the case, they'll say, hey, during the exercise, the rhythm has changed. Click to view. Now interpret it and make a choice about what you should or shouldn't do. And so a lot of the different cardiopulm cases actually have a mix of multiple systems plus some of this clinical reasoning built into it that you can already leverage into your classroom to help tease out some of the thinking. So I hope that's useful, Tiffany.
Yes, very. Thank you so much.
Yeah, absolutely. Other comments? Elaine, what do you think?
I looked at a lot of the units. I'm really loving this. The developmental milestones. It's funny. I mean, I've been teaching, as I was telling James, for a long time. And I've always had the students not only see videos of all of babies, but to be babies, So I've had them actually physically go through the developmental, the developmental changes. Of course, now we can't do that. Of course, I always ask the students if they have any problems, I don't want to hurt them, but they have found that really useful to actually do the movements, to go through from newborn all the way through the first 15 months, all types of transitional movements, supine to prone, through all the developmental changes that you've shown. So I really like this. This is going to be very helpful to me. I am also an NDT. I mean, I've trained in PNF with Maggie Knott, so I've been around for a long time. But and I trained with Stigmy Brunstrom, so the Fugelmeyer, I've used that for years. So the Fugelmeyer, is that a pretty extensive view of how to do the Fugelmeyer, or is it just I'm just curious
it's the whole deal. So
right.
If you go into neuro exam and you look at diagnosis specific stroke Fugelmeyer, every test is done for you.
Now this is going to be great, and I really believe in having the students prepare. I've forgotten who it was talking about threatening the students, but I mean, yes. I've used I've used quizzes and as I've told my colleagues, we're a brand new program. I said, we have to be absolute about this. If we say you need to prepare ahead of time, they need to, and then we'll clarify, answer questions, but we're not going to reteach it.
That's right.
So, and I really I like what you said about having the students when they come to lab, they have already gone through the procedure. I really like that because
Yes.
I haven't had that opportunity before. I mean, I've tried some things with simulations and all, but this is going to be great for our new program. So I'm very excited that we're going to be using it. I know
That's great.
the Pomona campus uses it, so I'm very excited that we'll have it.
Is this Western?
Mm-hmm. Yeah, we're Western University. We're the Oregon campus.
Oh, yes. Fantastic. Yeah.
So we're starting, and Tiffany, you were just talking with whom you were just talking. She's one of my colleagues.
That's great.
So we'll be starting our program July 1. So we're incredibly excited. We'll have 60 students.
You are one of those lucky groups that start your program in July 1, the summer of the end of the pandemic. How lovely is your timing?
No, I just think it's lovely. It's going to be great. I mean, it's a very small community in which we're teaching. Our focus is the underserved. So we're incredibly excited about the program.
That's fantastic.
Mike, I know Jeff's using it down at Pomona campus. Who else is?
Well, Jeff is at University of St. Scholastica.
Jeff Fairley?
Oh, Jeff Fairley is at the Western campus. Yeah.
Yeah, and he's using it. So
right.
Yeah, and then Elaine, I asked you, Karen Brandon is a friend of mine. I'm sure you're familiar with her, with Women's Health.
Yes.
Yes, yeah. She's a colleague of mine, a former student like Dr. Wong. As a matter of fact, she may have graduated same time you did, Dr. Wong.
Yes.
And,
well, that makes me think too, Mike, what about women's health? I mean, I didn't even ask about that. I didn't think about it until you just said that. Are there any components? So we have a number of us, like I said, I've been involved with women's health since the beginning of the section, and I
haven't, I think it's kind of been on my mind. I have a colleague who works over at the USC clinics, who teaches in some of the women's health, but actually integumentary is higher on my list than women's health, partly because universally wound care gets poor scores on the boards. And I think a lot of it is not necessarily the knowledge hasn't been transferred. They need games to play to apply the knowledge. It just doesn't sink in. There's no context, and they'll never get the context because they never get to go to clinic to do it. And so I'm working with a friend, actually she's a friend from Loma Linda, and we've started storyboarding a bunch of games, the common games of the common wounds, the common application of the types of debridement or the types of dressing. And because I think once the students can go, oh, that's what all of this stuff is used for, then they can take the boards and actually make some pretty decent decisions. Up until that point, I think we unfortunately, we give wound care 2 days max, 2 5-hour days. And then it plays it's a decent chunk. Surprisingly on the boards. And so initially I thought maybe we should build a wound care app, which we could still do. But in reality, I think most people are teaching the wound care content well. What they really need from us is wound care games. And once you get the wound care games, I think it will solve, it'll give your students the extra 3 points on the boards that sometimes they needed to pass.
And one thing, of course, is that there's a lot of crossover with other areas. I mean, it could be neurological, it could be cardiovascular and pulmonary, it could be a lot of orthopedics.
Yeah.
As you look at our clients, our clients in the women's health arena.
Yeah, that's true.
And you're talking about games, and I was thinking about, I've been around for so long, for example, pelvic floor, forever we've been using, you move the boat up you're trying to work on pelvic floor contractions, and you move
right. Or get the
flower. You shoot the basket, whatever. Right. So, but I was just curious, what.
Yeah, I haven't thought too deep about it. We've got a ton of things to finish in the main key areas: ortho, neuro, peds, acute care. And that includes all the simulations and all the real evals. I mean, filming real patients is just this, I think, really critical next step, so that no matter pandemic or not, students have an asynchronous way to experience what it means to view the patient, to treat the patient and examine the patient. So to me, those solve some of the big holes in the wall. And then certainly, apps in reality are very good for certain things and not good for others. And so usually what happens is, and I would invite any of you into a conversation for the future as you think through things, as you have inspiration. For example, we want to build a vestibular rehab app. I think that is very algorithmic. The techniques and the examination, the images of different people's eyes. I mean, there's so many cool things that you can do to pull that together. Prosthetics and orthotics. I'm not sure yet, but a couple weeks ago, we filmed a full eval of a prosthetist and a PT together, working together to manage the patient. And so sometimes I just film these things and then I kind of mull over it and think about what's the right model to create. Is it a game? Is it a simulation? Is it an interactive evaluation where the student just follows along and learns about the clinical reasoning that's happening? Or do we create a resource that is a library of the most common stuff, Yeah,
and you're talking about prosthetics and orthotics, and I teach a course in pediatrics. And I mean, the orthoses for little ones are just so many.
There's so many.
And so complex. I mean, really, I work with DAFOs and I mean, all kinds of, orthoses. And so, I mean, and it's really funny. You talk about having your apps and all. For me, I've been around for so long. When I came to Western, I said, I've got a lot of DVDs. They all laughed.
No, don't laugh. James is trying to get me to watch Goonies on his VHS.
No, and I'm like, okay. And some of those are really, I mean, they're really good because I actually did the eval. And then I did the intervention. I mean,
that's amazing.
When we could do this, I brought the patients in. So I have a wealth of videos and everything, and I truly want to convert some of them because I mean they're still useful.
Absolutely. That's fantastic. Hey, you're a game changer. Filming all of those are quite priceless if you think about it, for students to learn from example.
Well, I started out with my own children. It's really funny. I mean, I have videos. I have a full set of Denver developmentals on my daughter who's just getting ready to turn 35.
Wow. Well, Elaine,
I was telling James, I've been around for a while.
James and I will reach out to you. There may be things that we can do to share that content with faculty. I mean, I think all of that is I hope PhysioU, you see PhysioU as an evolving and also a mixing pot, a melting pot, where faculty who have created really cool things might be able to figure out a mechanism to share that with the world. Really, we have a really globally focused view. Everything that we are doing will be translated into Spanish, Japanese, Mandarin, and our hope is that collectively we can raise the level of rehab education and care, because we just published a paper recently talking about the idea that in many, many countries where rehab services are needed, PTs and OTs and speech pathologists will never exist as a profession. And that this is a serious problem that really we need to create little beacons of light in every single one of our students and hope to push them out into the world to make a big difference. So yeah, James and I will be reaching out to you, Elaine.
And thank you. I'm very excited to be able to use this. And today, so I had a little opportunity to look at it before, but today was so helpful. Thank you so much.
Wonderful. Wonderful. Thank you. Anybody else? Any other comments before we close this off? And thank you for all of you staying around. Remember, you can always reach out to me at mike@physiou.com. And yeah, any other comments? I mean, James and I are not in a rush. I know many of you have stayed more than the allotted time, but all your thoughts and comments are so powerful, so useful. All right.
I think we're good to go.
Yeah. Well, thank you, everybody. And remember that you can always check on our website for some of the newer webinars that are coming out that are a little bit of a deeper dive. And we look forward to being in touch. Take care, Elaine. Thanks for all your thoughts.
Thank y'all very much. It was great.
Bye, Charlene, Christine,
Absolutely.
and Michelle.
Bye, Charlene.
Bye.
Thanks, Christine, Michelle.
Bye now. Y'all take care. Be safe.
All right.
Wear your mask.
Wear your mask. Double mask. Exactly.
Double mask. That's right. Y'all take care now.
Take care. Bye-bye.